ਵਰਲਡ ਹੈਲਥ ਆਰਗੇਨਾਈਜੇਸ਼ਨ ਦੇ ਡਾਇਰੈਕਟਰ ਜਨਰਲ ਦੇ ਵੱਲੋਂ ਆਪਣੀ ਸਾਲ ਦੀ ਆਖਰੀ ਮੀਡੀਆ ਬਰੀਫਿੰਗ ਆਯੋਜਿਤ ਕੀਤੀ ਗਈ, ਜਿੱਥੇ ਉਹਨਾਂ ਨੇ ਹੈਲਥ ਕੇਅਰ ਦੇ ਮੁੱਦੇ ਤੇ ਚਰਚਾ ਕੀਤੀ ਹੈ। ਜਿੱਥੇ ਡਾਇਰੈਕਟਰ ਜਨਰਲ ਨੇ ਕਿਹਾ ਹੈ ਕਿ ਕੋਵਿਡ-19 ਬਿਲਕੁਲ ਖਤਮ ਹੋ ਗਿਆ ਹੈ, ਪਰ ਉਹ ਕੁਝ ਥਾਵਾਂ ਤੇ ਅਜੇ ਵੀ ਬਰਕਰਾਰ ਹੈ, ਜਿਸ ਕਾਰਨ ਸਾਨੂੰ ਵਧੇਰੀ ਸਾਵਧਾਨੀ ਵਰਤਣ ਦੀ ਜ਼ਰੂਰਤ ਹੈ ਤਾਂ ਜੋ ਅਸੀਂ ਇੱਕ ਵਾਰ ਫਿਰ ਇਸ ਵਾਇਰਸ ਦਾ ਸ਼ਿਕਾਰ ਨਾ ਹੋ ਸਕੀਏ। ਤੇ ਨਾਲ ਹੀ ਡਾਇਰੈਕਟਰ ਜਨਰਲ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਸਿਹਤ ਏਜੰਸੀਆਂ ਅਤੇ ਸਿਹਤ ਮਾਹਰਾਂ ਦੇ ਅਨੁਸਾਰ ਸਾਨੂੰ ਹਾਲੇ ਵੀ ਸਾਵਧਾਨੀਆਂ ਵਰਤਣੀਆਂ ਚਾਹੀਦੀਆਂ ਹਨ।
Last year has been another very challenging year for the health of the world's people. 1 year ago, Omicron had just been identified and was starting to take off. At that time, COVID-19 was killing 50,000 people each week. Last week, less than 10,000 people lost their lives. That's still 10,000 too many. And there is still a lot that all countries can do to save lives. But we have come a long way. We're hopeful that at some point next year, we will be able to say that COVID-19 is no longer a global health emergency. The criteria for declaring an end to the emergency will be among the topics of conversation when the emergency committee meets in January. Of course, this virus will not go away. It's here to stay. And all countries will need to learn to manage it alongside other respiratory illnesses, including influenza and RSV, both of which are now circulating intensely in many countries. However, we still face many uncertainties and challenges in 2023. Only 1 in 5 people in low-income countries has been vaccinated. Access to diagnostics and life-saving treatments for COVID-19 remains unacceptably unaffordable and unequal. The burden of post-COVID-19 condition is only likely to increase. And large gaps in surveillance remain, which is a weakness not only for defeating new variants of COVID-19, but also for monitoring the spread of other infections. As we look to end this emergency, we still need to understand how it began. We continue to call on China to share the data and conduct the studies that we have requested to better understand the origins of this virus. As I have said many times, all hypotheses remain on the table. One of the most important lessons of the pandemic is that all countries need to strengthen their public health systems to prepare for, prevent, detect, and respond rapidly to outbreaks, epidemics, and pandemics. An advanced medical care system is not the same thing as a strong public health system. One of the other key lessons of the pandemic is the need for much stronger cooperation and collaboration, rather than the competition and confusion that marked the global response to COVID-19. So I'm very pleased that last week, WHO's member states agreed to develop the first draft of a legally binding accord on pandemic prevention, preparedness and response based on the principles of equity, solidarity, and sovereignty.